Good morning. Good morning, everybody. Am I visible? Am I audible? Okay. Suswagatam. You are all welcome to my Saspandan TCM Academy. I am Vivek Rane, practicing acupuncture from last 35 years. So today is my first try to come on YouTube Live. So I decided every Sunday I will come on the YouTube Live. So it will be free session to all. So friends, can you message me on YouTube who is listening this session? Please, can you message me on YouTube link? Please message me if possible. Okay, thank you. Let's proceed. So we are here to learn about the how to deal with acute pain and acute emergencies. So when there is acute pain and acute emergencies, patient is suffering with horrible pain. So how we can help to patient to relieve that pain? So let us start. So there is the one way to stop acute pain in the TCM, in the acupuncture. There is a one way in the acupuncture to stop the acute pain. So that way is the Xi-Cleft point. So Xi-Cleft point. So I'm showing you, I'm sharing your screen. These are the Xi-Cleft point. All are requested, please stop your video Dr. A. Rajkumar Sharma. Rajkumar Sharma, please stop your videos. Okay, thank you. So there are the 12 meridian in our body, and in 12 meridian, there are one Xi-Cleft point in each meridian. So in upper extremities, there are the two polarities. In one is the yin and one is the yang. Okay, so in polarities, in meridian, so it is the pericardium 6, pericardium 4, LU6, and heart 4, heart 6. Heart 6, pericardium 4, and LU6. In upper meridian, upper extremities meridian, in hand meridian, and yang meridian in hand. So it is a LI7, triple wormer 7, triple hip 7, and SI6. SI6. Mr. Annamalai, stop your video. Only listen. Annamalai, stop your video. Please stop your video. Okay. So in lower extremities, in foot young meridians are bladder, gallbladder, and stomach. And in bladder and gallbladder stomach, each meridian have the Xi-Cleft point. So that in urinary bladder meridian, UB63, gallbladder meridian, GB36, and stomach meridian is ST34. And in foot meridian, it is the spleen, liver, and kidney. So spleen have SP8 Xi-Cleft point, spleen have the SP8 Xi-Cleft point, liver has the liver 6 Xi-Cleft point, liver 6, and the kidney have the kidney 5 Xi-Cleft point. Okay, so these are the 12 Xi-Cleft point. Just listen only. That not in the 12. I will discuss more about the Xi-Cleft points. So this is the basic thing. So in 12 meridians, there are the 12 Xi-Cleft points. Friends, Xi-Cleft points, also called the accumulation point, are all located between the fingers or toes. So below the elbow or below the knee. But with the exception of stomach 34, it is proximal to elbow. It is the above elbow. ST34 is the above, sorry, it is above the knee. ST34 is above the knee. Xi-Cleft means, what is the Xi-Cleft? Xi-Cleft means gap, and this refers to fact that the accumulation points are located in gap where the chi of the channels gather. So in flowing in a road, so there is when there are some heavy rains come and that rain stop. So there are the some any gaps on the road. In that gaps, water is gathered. Otherwise, road is dry. But in that gap, water is gathered like this. It is the gap on the meridian. And in that gap, so and that the accumulation points are located in the gaps where the chi of channels gather. Chi of channels gather and concentrate to fall deeper from the superficial level of channel. Okay. See, these are the yang Xi-Cleft point and yin Xi-Cleft point. So yang Xi-Cleft point is helps to relieve pain. So any pain in the yang meridian, okay, any pains in the yang meridian, so this Xi-Cleft point stop the pain. And yin Xi-Cleft point is related to blood issue. Okay, LIC1 for sore throat, if any inflammation and any soreness in the throat, so prick the LIC1. GB34 for stomach pain. If there is a intense stomach pain, acute stomach pain, so sorry, not GB34, ST34. ST34 for the stomach pain. Okay, and SI6. SI6 is the acute pain along the SI channel. Acute pain, whether it is the frozen shoulder, whether it is the elbow pain, whether it is the wrist pain along the LI channel, acute pain. And UB63, the pain along painful UTI, urinary tract infection. It is the painful UTI, urinary tract infection. And liver 6 is the painful acute cystitis. Okay. And in Xi-Cleft point, it is the lung 6, that cupping blood. If the some patients come to you and telling you, doctor, so blood is coming out when I am cupping. So can you do something for me? So yes, your answer should be yes. Apply the LU6, lung 6. And SP8, SP8, it is the painful menses due to blood stasis. So there is the cramp, so there is the abdominal pain, and there is a cramp, so unbearable pain. So in case of menstrual period, okay, this point will be stopped. It is because of blood stasis in the uterus. Okay, SP8 stop the pain and cramps. And heart 6. Heart 6 is the acute heart pain. Heart 6 for the acute heart pain. So, and kidney 5. Kidney 5 is the pain and clots during menses. And one more use of the kidney 5 when there is the kidney stone pain, acute kidney stone pain. It is an unbearable kidney stone pain. So kidney 5 stop the kidney pain. So prick the kidney 5 and allow blood come out up to 20 to 30 drop. So when you do like this, patient will be fast asleep and pain will be stopped immediately, and so he will be calm. And second day, if a patient drink lot of water, so stone will be fall down. Okay. Then pericardium 4, P6. It is for the chest pain. If there is a acute unbearable chest pain, so pericardium 6 work for the chest pain. See, there are points where the chi of the channel gather and are used mostly in acute pattern, especially when there is a pain. So they are therefore primarily indicated for the channels problem and are usually treated as they are mostly used for excess pattern. So any Xi-Cleft point is used for excess pattern. Another characteristic of this point is that they can be used to stop bleeding, especially in acute case and especially for the in channels. For example, lung 6 is the frequently used for the acute attack of asthma. HC, lung 6, acute attack for the asthma. And ST34, stomach 34 can be used for the acute epigastric pain. Spleen 8 for acute dysmenorrhea, that is the acute pain during period because of stasis, blood stasis in the liver, uterus. And bladder 63, urinary bladder 63, and liver 6 for acute cystitis, that is the inflammation of the bladder. So bladder 63 and liver 6 is for the acute inflammation of the bladder. Clinical application of accumulation point, Xi-Cleft point, is briefly as follows. So lung 6 is important point for acute asthma and cupping of the blood. It is very important point for acute asthma and cupping of blood. Large intestine 7 for acute or painful syndrome of large intestine channel. Stomach 34 is acute and painful syndromes of the breast because breast is located on the pathway of the stomach meridian. So it is useful in acute and painful syndromes of the breast and knee pain and acute epigastric pain. Spleen 8 is for acute painful period, excessive menstrual bleeding. If someone suffering with the excessive menstrual bleeding, spleen 8 can be used. Heart 6 for the severe acute heart pain and acute and bleeding. Heart 6 for the acute bleeding. Small intestine 6. Small intestine 6. Acute pain in the shoulder and scapula. And eye disease with pain. And bladder 63. Bladder 63 is the painful hernia like disorder. If hernia is paining, if someone have the hernia is paining, so bladder 63, painful hernia like disorder. And one more tips I am giving to you. In case of hernia, apply the master tongue point. Apply the master tongue point 11.01, 11.02, 11.03, and 11.04 on contralateral side, opposite side. If the right side hernia is there, apply this point on the left hand. This point on the index finger toward thumb side, on the middle phalange and lower phalange. Okay, this point you can Google this point. You will, so Google will give you exact location. Bladder 63, painful hernia like disorder, and acute cystitis, so inflammation in the bladder. And kidney pie. Kidney pie, it is the blood in the urine. If you are getting urinate and you find the blood, apply kidney pie. And also for painful period. Pericardium 4. Pericardium 4 for soft chest pain. Okay, so nosebleed, vomiting of blood, and coughing of blood. And triple armor 7, Sanjo 7, pain in the arm, and useful in post-viral fatigue syndrome. Okay, when there is the viral, so viral is controlled, but is fatigue is there. So apply the triple armor 7, Sanjo 7. Okay, so gallbladder 36. Gallbladder 36, the pain along the gallbladder channel. Liver 6. Liver 6 is the painful period, excessive menstrual bleeding, and painful urination. Is painful urination there? Excessive menstrual bleeding is there? Or painful period is there? Apply liver 6. Remember liver 6. Don't forget. So now let us discuss more. So we discussed 12 meridian Xi-Cleft point. So in addition, there are 4 accumulation or Xi-Cleft points for 4 of the extraordinary vessels. There are 4 accumulation points for the 4 extraordinary vessels. The yang and yin stepping vessels and the yang and yin linking vessels. So these are bladder 59 for the yang stepping vessels. And kidney 8 for the yin stepping vessels. Bladder 59 for yang stepping vessels and kidney 8 for yin stepping vessels. GB35, gallbladder 35 for young linking vessels. And kidney 9 for in linking vessels. So these are the 4 extra additionally Xi-Cleft point is there. Bladder 59, kidney 8, gallbladder 35, and kidney 9. Chi of the extraordinary vessels that gather at this point, which make them particularly powerful point to achieve the chi of the vessels. They can be used in the combination with the opening point of the extraordinary vessels. Opening point. For example, to point bladder 59, if you point to the if you prick the needle on the bladder 59 on the young stepping vessels. So for example, so is used for the sciatica on the lateral side. So it is used for sciatica pain for the lateral side of the leg, and also combine one point, it is the bladder 62. So when there is the pronounced stiffness and patient is not able to walk properly. If there is the stiffness and patient is not able to walk properly, so apply bladder 59 with combination with the bladder 62. See this, bladder 59 and bladder 62 for sciatica pain. Okay, it is a very painful condition, acute painful condition, and patient is not able to walk properly. Friends, Xi-Cleft point are first discussed in the systematic classic of acupuncture and moxibustion. The Xi suggests a cleft, gap, holder opening, and the Xi-Cleft point are where the chi and the blood, which flow relatively superficially along the channel from the chingual points, gather and fall more deeply. Xi-Cleft points in general are indicated in the treatment of acute condition and pain, while the Xi-Cleft point of the in channels have an additional action of treating disorder of the blood. Understand, Xi-Cleft, all in and yang Xi-Cleft point are using for acute pain and emergencies, while additional things in the in Xi-Cleft point they can treat. So their action of treating disorder of the blood. Remember this. So this theoretical concepts are clearly demonstrated by clinical application of this point. So let us see lung 6. So this is a lung 6. Lung 6 is important point both for acute disease of the lung and for disorder of the blood. It was traditionally in PCM indicated for attack of exterior pathogenic wind. So exterior pathogenic wind, heat, or wind dryness, and it's giving rise to febrile disease, acute cough and wheezing, swelling, and pain of the throat, and also loss of voice and for coughing blood due to any etiology. In modern clinical practice, the principal use for this point is the treatment of acute cough, wheezing, or asthma of any pattern. So I'm discussing in more deeply. So what this Xi-Cleft point can be able to do for us. Now LI7. So large intestine 7. So large intestine 7 is indicated in the treatment of acute disorder and pain affecting the large intestine meridian, and can clear heat and detoxify poison in case of closed sores and boils, throat painful obstruction, and heat and swelling of the face. Then ST34, stomach 34. Stomach 34 is unique among the Xi-Cleft points of 12 meridian in being located proximal to knee. So this is only Xi-Cleft point is located so proximal to knee. Otherwise, all Xi-Cleft point below knee and below elbow. Stomach channel passes through the breast and nipple, and stomach 34 is in TCM indicated for acute disorders such as the breast pain and breast abscesses. In modern clinical practice, it is also used for the acute epigastric pain. The next point is the spleen 8. Spleen 8, SP8. So SP8 has an important action on the resolving blood stasis. It's resolve blood stasis in the uterus and lower abdomen, and is indicated in the treatment of dysmenorrhea, especially when acute irregular menstruation and abdominal masses in women due to this pathology. When there is the stasis of blood in the uterus, so there will be masses, so abdominal masses in the woman. Then heart 6. Okay, this is the heart 6. So heart 6, sorry, not heart 6, small intestine 6. Very small intestine 6. Small intestine 6. Small intestine 6 for is indicated for pain of the shoulder, scapula, and arm that is so sore, so acute that it feels as if they are broken or dislocated. So it is also used for the distal point for acute contraction and sprain of the lumbar region. If the contraction and pain, acute contraction and pain in the lumbar region, apply SI 6 point. And heart 6 is the indicator for the sore, acute and unbearable heart pain because of heart stasis and for bleeding disorder because of excessive heat agitating the blood. In current practice, even though it's more useful for acute heart pain, this point is more useful for acute heart pain. So, pericardium 4. Pericardium 4 is the Xi-Cleft point. This is the pericardium 4. Can you see my cursor? Pericardium 4. Pericardium 4 is the Xi-Cleft point of the pericardium meridian and is more used for acute heart pain also. Relationship of heart 6 to blood is also expressed via its effects on the treating disorder of sweating. If there is the excessive sweating, apply heart 6, heart 7, and kidney 7. This combination, don't forget, heart 6, heart 7, and kidney 7 for excessive sweating. And bladder 63. So this is the bladder 63, red color point. Red color point, bladder 63. So this bladder 63 is indicated for sudden onset Shin disorder. It is a mental disorder, sudden onset of mental disorder, sudden turmoil disorder, and acute vomiting and diarrhea with cramp, and epilepsy and tiger joint pain. White tiger joint pain means joint pain is related to rheumatism arthritis. It's indicated for the white tiger if someone patient are suffering with the rheumatism arthritis, his all joints are stiff and paining. So try this point, apply this point. It's well, so, and in rheumatism arthritis, so the intense pain due to painful obstruction. And kidney pie, kidney pie is the indicated. See, this is the kidney pie. Okay, 1 chun below from the kidney 3. Okay, kidney 3 is located in between the tip of the medial malleolus. उसको हिंदी में या मराठी में घुटा बोलते हैं. Malleolus ankle bone. This is the ankle bone, tip of the ankle bone. Okay, and Achilles tendon. In between is the kidney 3 and come downward. So come downward, 1 chun. It is the kidney pie. 1 chun means one thumb breadth. One thumb breadth. Okay. So kidney pie is indicated for the variety of menstrual disorders such as amenorrhea. Amenorrhea means no menstruation. So amenorrhea, or irregular menstruation, dysmenorrhea, and delayed menstruation characterized either by deficiency of blood or stasis of blood. So if there is the liver blood deficiency or stasis of blood in the liver, so there may be delayed menstruation. Okay, and pericardium 4. Pericardium 4 is the primary point for the treating acute stasis of blood in the chest and heart, giving rise to pain. It is also indicated for heat. So uncontrolled bleeding in the upper jaw, manifesting as the nosebleed and vomiting or coughing of the blood. So triple burner 7, triple warmer 7, Sanjo 7, triple heater 7 is all names of the triple warmer. Okay, that triple warmer 7 has no relevant indications and seem to have been little used in clinical practice. And gallbladder 36. This is the triple warmer 7. Then gallbladder 36. So gallbladder 36, this is the gallbladder 36 on the tip, in between the tibia and fibula bone. And 7 chun above from the lateral malleolus. tip of the malleolus. Okay, 17 above. Gallbladder 36. This point is indicated for painful skin associated with the painful obstruction and also atrophy disorder as well as the rabies. So if the rabies or dog bite or any atrophy disorder. Liver 6. See this liver 6. So liver 6 is indicated for the stasis of blood in the uterus, shin disorder, and lower abdominal pain. So bladder, this is the liver 6. And bladder 59, bladder 59 is the Xi-Cleft point for the young motility vessels. Bladder 59. This is for the young motility vessel, but has the few relevant indication. Only sciatica pain, it is very useful. So it is combined with the UB62. UB62. So this is the UB60. Don't consider this one. So this point I shown you for the landmark. So UB59 and UB62 for acute sciatica pain on lateral side. And kidney 8. Kidney 8 is the Xi-Cleft point of the immortality vessels. So see this kidney 8 on the near the bone, very close to bone. Okay. Kidney 8 is Xi-Cleft point for the immortality vessels and is indicated for the irregular menstruation, dysmenorrhea, amenorrhea, and especially for the uterine bleeding. See, gallbladder 35. Gallbladder 35 is Xi-Cleft point of the young linking vessels, but has very few relevant indications. Then kidney 9. So kidney 9, see the kidney 9. Okay, so kidney 9 is the fortune about the kidney 3. So kidney 9 is the Xi-Cleft point of the in linking vessel and is traditionally indicated for the acute and mental disorder. Acute and mental disorders such as the madness, mania, schizophrenia, mental depression. So that mental depression, raving, fury, and cursing, vomiting of foamy, watery saliva, and tongue thirsting. So let us summarize the Xi-Cleft point of 12 meridians. So lung LU6, spleen SP8, heart 6, kidney 5, pericardium 4, liver 6, large intestine 7, stomach 34, small intestine 6, bladder 63, triple burner 7, gallbladder 36. So these are the Xi-Cleft point on the 12 meridian. So many advanced books define the Xi-Cleft point as being in areas where the channel pathway narrow and has a tendency to blockage and the accumulation of chi and blood. So a more clinically useful conception would be area where channel chi is filtered and flow is controlled. So Xi-Cleft point are like channel gate. It is like the gate on the channels. So that is the movable gate. So allowing chi to flow under it. If some gate is there, and when we pick up the gate, so the flow of water should be flow under that gate. So this Xi-Cleft point is like the channel gate. It's regulating the natural nature and rate of the channel flow. So as expected, these points are often found in areas along the body's surface where opening or clear separation can be readily palpated. Sometimes these palpable openings are between the bodies of muscles or in many cases between small bones. Now, there are total 16 Xi-Cleft points. So 12 regular Xi-Cleft points on the 12 meridian and more 4 Xi-Cleft points on the 4 extraordinary meridians. So there are total 16 Xi-Cleft points, one for each of the 12 regular channels plus the yin-yang chow vessels and yin-yang wei vessels. Xi-Cleft points have the ability to regulate the flow of qi in the channels. It is important to remember that they are by no means the only point with its ability. Type of flow regulation through to be occurring at different points along the channel varies. Understanding the nature of that variability comes from considering the point category. For example, the source point where the prenatal source chi enter the channels. So source point, if we consider source point, so all source points holding the kidney chi. It is a prenatal chi of the kidney. If the Xi-Cleft points are linked to stop light along the highway of the channel, then the source point may be linked to gas station. To extend the image of collateral points may be linked to a regulator along the small side road of complex road system. While the growth of the chi transformation among the 5 transport points may be represented by ever increasing speed limit sign along the increasing wide highway. While this image may be helpful. So this is the image. Why what I'm talking with this image. Okay, it is important to remember the changes in the nature and rate of the channel's flow can be affected to some degree at all acupuncture points. The value of point categories lies in the ability of this general grouping to help direct the practitioner to some of the most useful points on the body and the described way of visualizing how to creatively use this point in the clinic to affect physiology. So general function of the point. So it facilitates, number one, it facilitates of the chi to achieve pain and eliminate swelling. Number two, redirect counter flow. It's redirect counter flow to stop bleeding. It can be stop bleeding. So the Xi-Cleft point have two general functions, both of which are most applicable in relatively acute case in which pain is part of the symptoms. So number one, Xi-Cleft point facilitate the movement of chi to ease pain and eliminate swelling. This is the most common use of Xi-Cleft point and referred to unblocking channel circulation in case where lack of free and open circulation has caused to pain. So dysfunction of the Xi-Cleft point is especially applicable on the young channel, as this channel and their associated organs require constant movement for optimum function. And number two, redirect counter flow to stop bleeding. How? These are cases where counter flow of chi in the channels have caused to kind of stagnation. The stagnation in channels has built up in the channels and it's led to bleeding or brushing. That is, brushing means damage of small blood vessels. That is the brushing. Xi-Cleft point can be used unblock the circulation, reduce stasis, and slow the rate of bleeding. Net result somewhat counter intuitively is an increase in channel circulation and actually reduce bleeding or bursting. This function often applies to the Xi-Cleft point of the in channel, as these are one which tend to produce direct and nourish the blood. Okay, thank you very much. So this was about the Xi-Cleft point. So every Sunday I will come live on YouTube and Zoom for offering you pre-training in the acupuncture. So anyone have to give a speech? Anyone can give speech about that, what they learn in this sessions, how you like this sessions. Please. Okay, I will try to take the Hindi class. So Deepali ji Patel, I am going to unmute you. So talk how you like these sessions. Deepali ji Patel, I unmuted you. Come on the screen. Deepali ji Patel.
नमस्ते सर।
नमस्ते, वीडियो स्टार्ट करो।
सर बढ़िया रहा सेशन, वेरी गुड। और आपने जो सिखाया वो तो मिरेकल है। और मैंने बहुत सारे पेशेंट पे नी का और वेरिकोस वेन्स की ट्रीटमेंट की, तो बहुत ही बढ़िया रिजल्ट मिला है पेशेंट को, और वो बहुत ही खुश है। थैंक यू सर। और आप इतना अच्छा नॉलेज दे रहे हो, मिरेकल है। जो इसने मैं जो पढ़ी हूँ, इतना नॉलेज किसी ने नहीं दिया, ऐसा है सर। थैंक यू सर।
Okay. PN Vyas, I am going to unmute you. Dr. PN Vyas. Okay. 1 minute, Dr. PN. Okay. Unmuted to you. PN Vyas जी।
यस सर, बहुत बहुत शुक्रिया जो आपने पढ़ाया, बड़ी कॉम्प्रिहेंसिव है, बड़ा नर्स ने बताया, और कई कोर्सेज आपने पहले करवाए हैं यीन ऑर्गन के ऊपर, यान ऑर्गन के ऊपर। वंडरफुल, मार्वलस सर। और मैंने मेरे प्रैक्टिकल लाइफ में भी इसको यूज किया है, इसलिए बहुत बहुत शुक्रिया। थैंक यू वेरी मच सर, फ्रॉम जयपुर, राजस्थान।
Okay. Thank you. Aishwarya, I unmuted you. Talk something. Aishwarya, please come on screen. हाँ ऐश्वर्या,
कुठे गेला?
हा व्हिडिओ ऑन कर.
हो हो करते. हा सर.
हा, हाऊ यू लाईक द सेशन अँड व्हॉट यू
खूप छान
लर्न.
खूप छान झालं आजचं सेशन. Xi-Cleft पॉइंटची मला फारशी माहिती नव्हती, पण आजच्या सेशन मधून खूप जास्त माहिती कळली. आता याच्या पुढे तुमचे जे असतील ते सर्व मी अटेंड करेन. अच्छा, एव्हरी संडे घेणार ना तुम्ही?
हा एव्हरी संडे, एव्हरी संडे.
सर याचं रेकॉर्डिंग असेल आम्हाला?
रेकॉर्डिंग हा तिथे युट्यूबची लिंक आहे ना, युट्यूबच्या लिंकवर तुम्हाला भेटणार ना. रेकॉर्डिंग
ओके.
द्यायची काही गरज नाही. युट्यूबची
ओके.
लिंक आहे ना. हा
हा हा.
ओके,
खूप
हा
छान
युट्यूबच्या
झालं.
लिंकवर तुम्हाला भेटेल रेकॉर्डिंग सगळं.
ओके सर, थँक्यू सो मच.
ओके ओके ओके. नो वॉल्यूम इन यूट्यूब, आवाज नहीं है. ओके. Anyone want to tell? Munisha, sorry, Munita Patel. Munita Patel, come on on the
नमस्कार
screen.
सर.
हाँ नमस्कार नमस्कार.
सर यूट्यूब चैनल चालू किया था, उस पे वॉल्यूम नहीं आया, काफी क्लास मिस हो गया, मे बी नेटवर्क इश्यूज और व्हाट आई डोंट नो. और फोटोज मैंने देखे हुए हैं क्योंकि आप वो टेलीग्राम और उस पे रखते रहते थे, तो आई कुड कनेक्ट. बट मुझे यूट्यूब पे वॉल्यूम नहीं आया. देन आई स्विच ओवर टू जूम लिंक, क्योंकि पहले जब जूम में जा रही थी तो वो कनेक्ट नहीं हो रहा था. आई डोंट नो व्हाट सिचुएशन, बट आई वुड रिक्वेस्ट यू टू गिव रिकॉर्डिंग. और यूट्यूब चैनल भी टेस्टिंग करके वॉल्यूम थोड़ा चेक कर लेंगे तो बहुत अच्छा रहेगा. बट दिस व्हाटएवर आई कुड गेज एंड गेट इट, यानी छोटी छोटी इश्यूज जो हैं वो एक एक पॉइंट से कैसे क्लियर कर सकते हैं इज मच हेल्पफुल. दिस इज व्हाट इज माय फीडबैक.
जिक्लेट पॉइंट. सो और उसमें और एडवांस आने वाला टोटल 4 से जिक्लेट पॉइंट के ऊपर मैं 4 सेशन लेने वाला हूँ. वो भी सारे फ्री एवरी संडे. ओके, तो वो चारों सेशन में आपको और क्लियर होते जाएगा. उसके साथ और भी कॉम्बिनेशन
सर जब मैं सिडनी में थी, मुझे याद है मैंने आपका एक सेशन अटेंड किया था जब आप टेलीग्राम पे लेते थे, तो मुझे बहुत कफ हो गया था और सो थ्रोट हो गया था. मैं यहाँ दबाओ, बस यहाँ दबाओ, दबाने से ही ठीक हो गया था, बाकी सब तो छोड़ो. यानी इतना पावरफुल है. तो अगर हम सुनते भी अगर याद रख लेते हैं ना, basically you cannot remember everything, you have to write down, but when you remember something when you have a problem, तो वो लाइफ लॉन्ग याद रहता है. तो आप जिस तरह से बोलते हैं, और अगर हमने उसी वक्त प्रैक्टिकल कर लिया कि यार यहाँ दबा दिया, आवाज खुल गई, ये कर दिया, वो कर दिया, तो मेनी थैंक्स. रियली अप्रिशिएट ऑल योर एफर्ट्स एंड योर नॉलेज. तो यू आर एन ओशन. अब उसमें हमको कितना डुबकी मार के निकाल के अपना मोती निकालने हैं वो हमारे पे. थैंक यू वेरी मच सर.
ओके, थैंक यू. हाँ मिथिलेश जी, हिंदी क्लास होगी, जरूर होगी. सो अभी जो इंग्लिश के साथ हिंदी भी बात करेंगे नेक्स्ट संडे से, नेक्स्ट क्लास से हम कोशिश करेंगे हिंदी का भी. सो मिथिलेश जी, मैं जो इंग्लिश बात कर रहा हूँ वो वेरी अंडरस्टैंडेबल है, बहुत इजी है. इजी इंग्लिश बात कर रहा हूँ मैं. ओके. ओके, देखूंगा. Okay, thank you very much. So ending the session.